Dizziness is one of the most common reasons that people visit their doctors. It can make them feel off-balanced or lightheaded. Most of us will be dizzy at some point in our lives, whether it's a childhood game of spinning in circles, anxiety, a nasty ear infection, or too many drinks. Dizziness is a feeling we are surely familiar with in one way or another. While dizziness can be a side effect of minor health issues, it can also be a sign of a serious health problem. Dizziness isn't a disease, but rather a symptom of various disorders. The specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery explain how they search for the underlying causes of dizziness using vestibular testing.
Dizzy is a very broad term, and we often like the primary care doctor to have evaluated the patient from a dizzy standpoint because it can be something cardiac or neurological in origin, and that probably needs to be looked into or ruled out beforehand.
If the physician determines or suspects certain issues in balance, then that's where that would trigger an order for vestibular function testing. Vestibular is actually a system within your body, and that component comprises of the vestibular nerve in the inner ear, and affects your eyes, your brain, your strength and extremities. The physician may notice through their evaluation the patient's inability to perform certain exercises or walk properly, and then that would lead to other questions from the physician. I primarily perform vestibular function tests for patients suffering from dizziness, and that's used to detect what's called a nystagmus. A nystagmus is an eye twitch or an eye move that is commonly associated with dizziness. And that's just a reaction. Everyone gets it. And then you use that nystagmus to analyze where the dizziness is coming from.
So we've taken audiological services into the vestibular lab and then incorporated ENG testing, which also kind of helps us better diagnose the type of problem with the balance system and equilibrium.
50% of people suffering from dizziness is going to be an inner ear issue or otologic issue. You know, dizziness for the aging population can be a pretty serious factor when you incorporate fall risk. It's a very simple test to perform, and you know, if they do have something wrong with them or a inner ear disorder, it's easily treatable, and they don't have to live with a debilitating sickness or dizziness all the time. We've been able to cure a lot of people so that they can move on and live fulfilling lives.
For more information on dizziness, as well as links to the specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Spin on Dizziness story link on our homepage at yourhometownhealth.com.